Hello everyone. I would like to begin by acknowledging the traditional owners of the lands where we are meeting, virtually in my case, and to acknowledge the elders past and present, and to acknowledge the Aboriginal and Torres Strait Islander people present in the room there today. I apologise for being unable to be there in person with you due to bad weather conditions, making travel on my particular country road quite unsafe at the moment. The extreme weather that many of us have experienced in the past few days is a reminder that disruption is likely to become the new norm at so many levels. This image on the screen represents the diversity and resilience of the peoples of the oldest living cultures on this planet. It is often said that in order to begin to imagine the future, you need to understand the past. This image reminds us that the longest narrative of this continent is of peoples who practice sustainable cultures that cared for and respected life in all its forms. This image is also, sadly, a reminder of the harmful lack of respect embedded in the more recent mainstream and colonial narrative in locating a national day, supposedly for celebration, on a date that symbolises dispossession and all of the traumas of colonisation. But we can also see this image of #SurvivalDay as a symbol of the power of resistance and the possibilities for challenging and rewriting the dominant narratives. We can also see that new forms of power are arising in the networks enabled by online connections, and that these are challenging the dominant story in so many domains. I thank Nathan Appo for permission to use this slide. Through his health promoting work with the Deadly Choices program, Nathan is actively involved in challenging some of the dominant narratives around Indigenous health, working with the strength and creativity of communities to improve health, rather than with the deficit focus that we so often see in narratives that undermine rather than promote well-being. What has this to do with the future of health? A huge amount. At present, we have a very unhealthy narrative about health. It is a narrative that equates medicine and hospitals with health. I have heard this narrative so many times in this election campaign already. The politicians and the journalists, when finally they turn their attention to health election issues, invariably the talk is about hospitals and hospital funding. It is a story that misleads how we think about our health. It is a story that contributes to policies that undermine health. And it is a story that stops us from imagining what it will take to create a healthy future for our children and their children. If we could have the next slide now. Thank you. Do you recognise this photo? It was taken when people were recently fleeing the devastating bushfires in Alberta. When I think of the future issues for public health, this photo seems so symbolic. The World Health Organization has described climate change as the pressing public health challenge of the century. You'd never guess that that's the case if you look at the priorities of the Federal Health Department, though, which under the current government seems to be doing everything possible to divest itself of any responsibility for public health. When I look at this photo, I try to imagine what the people in that car might have been talking about, if indeed they had the time for talking. What were their priorities and concerns? In some ways, I feel like we are all in that car. Overhanging us is the spectre of the disruption and the destruction of climate change, which will affect our health in all sorts of ways, both predictable and as yet unforeseen. But in the car we're driving in Australia, at least, we're talking about anything and everything but this existential threat. We are even talking about opening new coal mines. Why don't we just throw some petrol on the fire racing up behind us? This photograph also reminds me of one of the big lies in the story we currently tell ourselves about health. Not only do we make it a story about medicine and hospitals, the only characters featuring in this story tend to be people. Recently, I was listening to Professor Kerry Arabina, Chair of Indigenous Health at the University of Melbourne. She was speaking on ABC's Big Ideas program and made a comment that is absolutely critical to how we rewrite the narrative about health. She said, "We don't live in a society, we live in an ecosystem." In some ways, this doesn't seem such a radical concept really. I'm sure I can remember learning back in my school days about the interconnections of the web of life. It is only a radical concept if you believe the narrative that you are currently told about health, that you'll be healthy if you eat well, exercise often, don't smoke, don't drink too much, and of course make enough money to be able to pay for your health care. The idea that we live in an ecosystem is only a radical concept if you believe the narrative that I hear just about every morning on my wireless or every evening on the telly, where various talking heads impress upon me that I live in an economy, not even a society. Imagine if there was as much political and policy concern for the indicators of a healthy ecosystem as there are for the indicators of a healthy economy. On that point, though, we need to transform our understanding of what makes a healthy economy. There is overwhelming evidence that social and economic inequalities are contributing to health inequalities and poorer health for many people, particularly children and young people, and particularly for Aboriginal and Torres Strait Islander peoples. We cannot begin to create healthy futures unless we broaden our health narrative to address the role of the wider determinants of health, and thus the role of wider policies. Health in all policies is a very useful framework that should be used much more widely in Australia. I was delighted to hear that John Hewson recently proposed that all policies should be subject to a health equity assessment. He was speaking at a conference here in Canberra convened by the NHMRC Centre for Research Excellence on the social determinants of health equity. If implemented, this would be a development worthy of that much overused and abused phrase. It would be, quotes, a real breakthrough for health. Amongst other things, it would serve to illuminate how often policy is contributing to the poor health of individuals and communities, particularly for those who are already at greatest risk of poor health. It would also highlight that some of the greatest opportunities for future health lie not within the health portfolio, but within other arms of government and outside of government too. On related matters, have a look at an article just published at Croaky this afternoon in which Professor Fran Bohm, co-director of the Centre for Research Excellence, and her colleagues argue the need to move beyond the narrow biomedical research agendas. Could we have the next slide, please? This is a photograph recently taken on a beautiful afternoon walk around Sydney Harbour. The tranquility of the waters inspired reflection and contemplation. I show it in order to encourage reflection, individually and collectively, about the stories we tell about our health. It is also a moment for reflecting upon the Aboriginal definition of health, which states, quotes, "Health is not just the physical well-being of an individual, but refers to the social, emotional and cultural well-being of the whole community in which each individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community. It is a whole-of-life view and includes the cyclical concept of life, death, life." As Dr. Tim Senior, a GP, has written at Croaky, this definition uncouples disease and health, allowing that it is possible for someone to be healthy even if they have an incurable chronic condition. Death is even part of health, provided people have been given a chance to reach their potential. This definition also reminds us that poverty and inequality, environmental degradation, social exclusion and racism, and human rights abuses are critical health concerns. We can invest billions in hospitals, but we need to move beyond the limited narrative of health equals hospitals and medicine. Just to be clear though, I'm not for a moment suggesting that equitable access to safe, quality healthcare, particularly primary healthcare, is not important. It is, and we should all be worried by the seemingly inexorable undermining of the principles of universal healthcare in Australia. But funding healthcare is not enough. You can put as many dollars into hospitals as you have, but this won't do anything to address critical health problems, such as the over-incarceration of Aboriginal and Torres Strait Islander people. A reminder of the importance of human rights and social determinants frameworks for ensuring better health for all. No matter how much we spend on healthcare, this will not stop the tide of non-communicable diseases that have emerged as such an important public health concern. To do that requires action across a range of other domains, including but well beyond healthcare. We also need to move beyond the narrative that frames spending on the community's health as a cost rather than an investment. So my long distance challenge to you all is, how do you reframe the dominant narrative around health to ensure that the stories we tell and the stories we hear actually contribute to a healthy future for the planet and all who reside upon her? Thank you very much.